Hello there, sweetie. Yes, just go ahead and sit on the bed for now. So you're coming in to have a surgery today? Okay. And can you tell me your name and date of birth? Okay. Just gonna cross-check that with our system. Just have to do some prep things before you're all ready to go. How are you feeling about it? A little nervous. Yeah. That's normal. Okay. Okay. Sorry, I had to log in. It can take a little bit of time. Okay, so okay, that all seems to check out in the system. And can you tell me what procedure you're having done today? Okay, very good. Yep. I don't wanna have you going into the wrong surgery, right? No, that's never happened. Not here anyway. That's why we double check. So, okay. So I need to get some vitals. I need to take some blood, and I need to hook you up to the IV. All right? All right. I'm gonna do just a couple of tests, take some notes, cross-check things. So. Do you have any family history I need to be aware of? Like diabetes, high blood pressure, cancers, things like that. Okay. I'll double check that in the computer to make sure that we have that in there already. Can you see your wrist? Thank you. I'm just gonna place this on there. And okay. Alright, that sounds good. Heart rate is a little high there. Just check with the blood pressure cuff as well. So, have you had surgeries before? Okay. Well, this should be fairly easy for you, and you'll only have like 2 weeks of downtime. I know, it's very surprising, isn't it? Okay, let me put this back on actually. And then place this under the cuff. Okay, just gonna start. Okay. that off of you. Everything looks good there. Let me double check what you told me. That on your mother or father's side? Okay, yeah, we have it in here already. Yeah, if you filled out anything, you know, online beforehand to make things easier for us, then yeah, it's in there. It should be all good. Another nurse will check that with you, but before I start hooking you up to things, I'm just going to give you this bag for your personal belongings, alright? So you're going to take everything off. There's a gown in the bathroom already. Just put that on and then come back out and you can get comfortable in the bed as we start doing everything else, alright? Okay, so yep, that's for you. Alright, and I will just be out here. Yeah, go ahead, take your time. Yes, make sure to take off any jewelry, watches, anything like that. You can leave your glasses on until the procedure, and then a nurse will take them. Yeah. Yep, we'll make sure they get back to you. Okay, you're all set? Great. Yeah, you can just leave the bag over there on the counter, and like I said, you can sit for a minute and then we can get you comfortable in the bed. Were you swabbed for COVID prior to coming in? No. Okay. So let me go ahead and do that now then. Yeah, we'll get those results back right away. We're still being careful with COVID going around, so we'll make sure we swab everyone before procedure just to keep your doctors safe. So, but you should be alright. So just tip your head back a little bit for me, and I'm going to go up your nose, and on the other side. Okay, very good. And I'll just take that and get that tested for you, and we'll keep going. Let me take your temperature real quick. Go ahead and put that under your tongue there. Okay. All right, looks good. I'm going to take some some blood samples. Like I said, we have to test them. And then, are you okay with us taking extra blood to keep aside in case you need it during the procedure? Or is it alright to give you more blood if you need it? Okay, let me have you sign something in a second. Okay. Okay, yeah, so just where it says right there by the X, yep, just go ahead and sign that for me. Very good. Yeah, that's just in case. We don't normally need it, and especially for the procedure you're having, it shouldn't be necessary, but as I'm taking the blood, it's just easier, you know, to get the okay. So I'm going to take a little bit more so we don't have to prick you again. Yeah. Okay. And do you know your blood type? If not, we'll figure it out when we take your blood. Okay. Yeah. Okay, so I'm just going to tie this around your arm. Can you put it out for me? Okay, thank you. Tie this. Tie that around your arm there. And then I'm going to wipe down your arm now. Make sure everything is sterile. Okay. Okay, very good. And I'm just going to take going to stick you and then just take a couple of vials of blood, okay? Okay. Alright, there's the first one, very good. Second one. Okay, you can pass these off to the nurse again. Thank you. And then we'll put this around your arm. Okay. Very good. Alright. You still doing alright? Okay, so let me just get you your wristband now, and I'm going to have you confirm your birth date and your name again. Okay, let's just tear it off here. Yes, I'm going to be your nurse through the whole thing, so you'll see me before and after, okay? You will be with another nurse when you come out. And they are just going to make sure you wake up alright, get you some food and water, and then you'll be good to come back here and you'll be on your way, okay? There we go. And then I have to give you another one because you okayed the blood, but we have to wait until we get the results from the test. Okay, so I'm just going to put this on your arm there, and your name and your birthday again for me. Okay, everything looks good. And what time was your procedure set for? Just remind me. Okay, very good. So we will wait for the okay for that. Some other things. I just want to test your eyes and everything. Make sure you're neurologically okay? Just real quick. So just stare straight ahead for me. Yeah, I assume you are, but we just have to make sure we're not going into a procedure, starting something, and finding something else is going amok, you know. Something else is happening. Okay, so I'm going to cover your eye. Good. Alright. Good. And then I'm going to compare. Okay. Okay, good. And take the blood samples. All of them. Get your wristband. Thank you. Okay. Prep the other one for me, so go ahead with your name and your date of birth again. Okay, that one's good. And your blood type is on here, so if we need to give you more blood, then we're good to go. Alright, do you need, let's see, do you need anything to keep your hair out of your face? You have a hair tie? Okay. Would you like me to put it up for you? Okay. Yeah, I can do that. I have done everything else. If I miss anything, I'll come back in the room. We've got, let me check. About half an hour before you're supposed to go back. The doctor will come in here. If I didn't say that already, the doctor will come in here, just check in on you, make sure everything was all right for all the prep work you did last night. You didn't eat for at least 8 hours before this, right? Okay, good. And then no water either. Okay. Yeah. Yep, that's just to make sure you're all good and nothing's gonna happen during the procedure that we don't expect. So are you okay with me just putting it up in like a bun or so? Okay. I'm just gonna scoop it up for you. Scoop it up, scoop it up. Okay. Alright, can I see that hair tie? Thank you. Yeah, it's a little bit of a messy bun, but that's probably alright. They're going to put a cap on you. I don't have it with me, but before they take you back, they will come and put a cap on you, okay? And then it'll just hairnet. that'll just keep everything out of the way and sterile. Do you have any other questions about anything? Okay. Yes, we can let your family come in here while you are waiting. That is no problem at all. We need to get you hooked to the IV. That is my job as well. Let me just get new gloves. Okay. Yeah, that's very important, isn't it? Okay, so same kind of deal. Since we took blood from this arm, do you want the IV on this arm, or like you can put it on your hand or your wrist? Just wherever you're most comfortable, probably the opposite of your dominant hand, whatever you want. Okay. Yeah, so we'll do that there then. Pull this back out. Just go ahead and hold your arm out for me. I am going to insert the IV, and then I will put a little bit of the tape over it so it doesn't move around. I might put it in 1 or 2 spots just so, you know, it's got better stabilization. Yeah, okay. Okay, thank you. And you don't have to look if you don't want to. Okay. here. Need to wipe it off. Sterilize the hair again. Okay. Now I'm going to insert. Alright. It's in. I'm just going to hold it in place. Okay, so that's going to hold it for us. Is it okay? I know it's kind of uncomfortable at first, but then should be alright. Okay, if it starts to bother you at all, let me know and we'll see about maybe readjusting where the tape is or just putting it somewhere else, alright? Should be good until we take you back. Yep, I will go get your family. And like I said, if I need to do anything else beforehand, I will be back. But I think most of it. Okay, just check do everything on here. Yes, the doctor is just finishing up with another patient, and then you will be up next. They'll just have to clean the surgical room and everything. When you are done, we will give your caregiver or family, whoever is with you today, a packet of everything that was done, everything you need to know, and then your prescriptions will be sent to the pharmacy, so all you and your family will have to do is pick them up on the way home, okay? And then, yeah, you will get something to eat when you're out, yeah. Okay. Yeah, feel free to ask me anything else if you want to, or anything comes up. Did you need to go to the bathroom at all before? I know you haven't had much to eat or drink, so you probably really don't have to, but I just like to check. Okay, if you ever want to beforehand, you can let me or another nurse that might pop in know, and we can help you walk everything to the bathroom because now you have the IV, so yeah. Yep, no worries. Like I said, any other questions before I step out? Alright, your family will be coming back here as soon as I get them, okay? Okay. And we'll also let you know if there are any delays with the doctor, with the person before you. So, yeah, somebody will give you an update if it's necessary. And also the anesthesiologist will make a stop in here as well, and they will let you know kind of what their plan is, and if you have any sensitivities to certain anesthesia, they'll ask you about that. Yeah, since you haven't had it before, they'll talk to you about what they're gonna do. Mm-hmm. Yeah. Okay. All right. I believe I have everything now. Okay. So. Yep, just go ahead and get comfortable in the bed. I can pull the blankets up over you if that would help you out. I know it's awkward in the gown. So yeah, just go ahead and get comfortable. I'll just pull this up. Okay. There you go. And the remote is attached to the bed, so you can go ahead and use that if you'd like. Turn on the TV so you have some noise, and we'll get you all started so you can head home, okay? Alright? Okay, I'll see you in a couple of minutes probably. Just relax. Alright. Hello, I am Dr. Alyssa, and I will be doing your face exam today. What brings you in? Yes, it is obvious. I just need to confirm that I have the right person. Okay. So and can you go ahead and tell me your date of birth, please? Okay, good. And so, face exam. Can you tell me a little bit about what happened? Okay. So, you're just wondering about a procedure. Okay. Alright. And yeah, how did this happen? A bar fight? Okay. Okay, yeah. And have you sought out any kind of medical help before coming in here? Has anything been done, either, surgically or superficially? Just anything before this? Okay. So you just left it, and that's how it healed. Okay. Was there glass involved at all? And you didn't seek medical help? Okay. Okay. Before I get started, do you have any allergies to latex or any certain medicines? Anything like that? Okay, and I am going to take your temperature just to see. Yep, right under your tongue. We want to rule out any infection. How long ago did this happen? A little over a week. Okay. Yeah, because it looks like some of it's still healing. Very good. Okay. Alright. So, you don't have a fever, which makes me think you don't have an infection. Let me take a look with my light before I start feeling around, just to make sure that that there's no visible glass. If there is, then I obviously won't be pressing on it. We don't want to make it any worse. So just put myself here. I'm going to turn this light on. If you have issues with light, you can go ahead and shut your eyes while I do this. Otherwise, just pick a spot to look at so you're not looking directly in the light if I go over your eyes, okay? Alright. Okay. And was there a sign that this was like more severe on as it was healing, like right after it happened? Okay. This side. Okay, yeah. Pardon me, my lip is puffy. any glass with my eyes. Let me. Got a Q-tip ready. I'm gonna start feeling around now. Okay, I'll be gentle at first. Let me know if you feel any sort of pinch. Anything sharp. So that way we can get a better look at it. Feel across your forehead now. Alright. Anywhere there bothering you at all? No. Okay. How about your jaw here? Okay. And was everything alright with your jaw afterward? Didn't feel dislocated or anything? You can wiggle it around. Okay. Yeah. And no issues with opening and closing your mouth. Like I said, no dislocation of your jaw. Nothing like that. Alright. Anything here? This is where it's the most affected that I can see. A little bit of a pinch. Okay. I'm going to take my finger and run it over it. Tell me where you feel it. There. Okay. So let me just. Okay. I'm gonna take two of these. I'm just gonna try to. Okay. Yeah, there was a tiny, tiny piece there. So in most cases, if anything is stuck in our bodies, either we will deal with an infection or our body will absorb it and break it down in a sense. So if there is or was anything, it most likely was absorbed. What kept you from seeing the doctor, like an ER doctor at first or so? Okay, yeah. Okay. So, I'm going to now just feel the structure of your face, kind of under the scarring. I'm going to ask you to do some movements as well, okay? So let me just, again, reevaluate here with the light now. Okay, so we're at the jaw. Just go ahead and open and close your mouth for me. And can you wiggle your jaw from side to side? Good. Okay. And is there any pain at all with that? Okay. So I'm going to try to open your mouth, alright? You keep your jaw locked, okay? Yeah. Alright. Very good. And now open your mouth for me and I'm going to try to close it. Okay, no pain with that? Very good. Okay. Let's try your eyebrows. Just can you raise your eyebrows for me? Okay, and can you go up and down with them? Very good. And can you furrow your brow there? Good. Okay, and I'm gonna have you raise your eyebrows. Don't let me push them down. Okay, now lower them, and it might be a little. I don't expect you to not be able to make me, because I guess if you furrow them, keep you from pushing them up. Okay, yeah. And then around your eyes, go ahead and close your eyes. Just gonna feel did anything get in your eyes at all when this happened? I'm not sure. Okay. Yeah, I'm gonna use the light again. And just pick a spot behind me to look at, please. I'm just gonna check. Reaction's good. And then I'm gonna pull your lid down here and just take a look. And over here as well. Very good. And then go ahead and look down for me. Turn your lid up. Same thing for over here. Okay. And no sharp pains with your eyes at all. Nothing feels like it's in it. Avoid a corneal abrasion and just obviously having anything in your eye. I don't see any redness or any visible tears that might have occurred, so that all looks good. So you said you were interested in a possible procedure because you got a little bit of scarring going on over here now. Yeah, it'll continue to heal kind of how it is, and you will see bumping there. So if that's what you're interested in a procedure to kind of correct that, especially before it completely heals, then I can definitely refer you to someone. I just kind of do the exams and do the first looks, but we can get you to a surgeon. Yes, and I'll find a good one for you to use. And I'm gonna just do some measurements for the surgeon just before and after. Do you have any pictures of yourself, preferably head on, where we can see what your face previously looked like without the scarring? Okay, yeah, that'll help the doctor, the surgeon. And I'm gonna take some measurements of some things now. Let me see about how big this trouble spot is here. Okay. And are you mainly concerned about this area here getting fixed, or you have little bits of scarring starting over there? You want to wait and see how that one heals. Okay, so would you still like me to take measurements of it so we can get that to the doctor if you change your mind? Okay. Yeah. For a surgery like this, it is going to take a little bit to, you know, get into the, not the surgeon's office, but just like getting to the surgery. Yes, because facial surgeons are quite busy, yeah. Okay. And then, just get some. Okay, can you rest your face for me again? I'm gonna do. Yeah, that is quite a large space there. Now, can you open your mouth for me? Like, please. Okay. I'm just gonna measure about. There's no changes to the size when you move your face. So, and can you blow your cheeks up? Is that possible? Does it hurt at all? Okay. Yeah, if it hurts, obviously I wouldn't want you doing that, but you said it's about a week. Yeah. So there might not be too much pain with that anymore. Let me see. Okay. So when you go in for the consultation, they will take before pictures. They'll take a picture of everything that's going on as the before, and then after the surgery and you've healed up, they'll take an after like that. And that's why I said if you have a picture of yourself face head on, then they can use that as a model to try to recreate anything if they have to absolutely recreate something. And yes, so let's move on to cleaning you up a little bit. And just do a quick clean over so that way if anything is lingering, we kind of stop it in its tracks. I just have to absolutely no pain now at all. Okay. Yeah, I didn't see a fever. Now, I'm not going to bandage this. Did you have it bandaged at all for the first couple of days? Worse spots? Okay, yeah. Yeah, we still want it to be able to air out. And heal up as best as it can. If it gets too moist, it could also cause infection. So, yeah, just want to let it kind of do its own thing. And yeah. So your face will kind of dry up from the alcohol wipe there, and it should all be good. Do you have any other questions? Yes, the receptionist can get you the contact for the surgeon, as well as I will reach out to them and let them know. And you can get that ball rolling after you have that information, okay? Perfect. So, okay. So quite a few dogs barking today. Not sure why there are dogs near the doctor's office, but alright, so yes, I'll give the doctor, the surgeon, the rundown of what you told me, like notes I took, and then measurements and just general areas where the doctor will be looking, so they're aware. Okay. And that way they'll have most of this information before you go in, but you will still have to you will still have to tell the surgeon everything that happened and just kind of go over it all again. All right. So we got right side is okay. have everything I need. Are you sure there's nothing else you need to ask or let me know about? Okay. Okay. Alright, we'll leave that up to the surgeon to ask you more specific questions about medications and things like that, okay? Alright, so, thank you for coming in. I'm sorry that this is the circumstance. Bar fights, though, yeah, they can be a bit rough, so, yeah, well, I'm glad I could get this looked at for you and get you headed to where you need to be going, or where you want to be going, to make yourself feel better, okay? And, yeah, so you can head out to the receptionist there, and she will get you all the information you need moving forward, okay? Okay. Alright. Bye. Hello. I am Dr. Alyssa. I am going to be taking care of you today, okay? So, the nurse didn't give me the rundown, so if you could just tell me your name and your date of birth and what brings you in here today. Okay. Okay, so you're having some eye pain. Headaches. Any nausea, fever. Okay. Not sure what you normally look like, but to me, you're looking a little bit pale. So, are you sure? Okay. Well, how about a cough? Do you have a cough at all? Okay. So let's say you did have a cough. No, okay. Alright, so, okay, no. Anything else I need to be aware of then? Because I don't think I have enough criteria to really match it to anything that's in the book at the moment. Fatigue, okay. Okay. And how's your sleep? Okay, you recommended 8 hours. How's your diet? Any leafy greens? It's just what I need to know, okay? Okay, so mainly proteins then. Alright. Okay. That could be your problem right there. You're not very well balanced. How about, easy question here. How's your water intake? Okay, well, normally we, it depends on, like, your height, your weight, sometimes your gender, things like that, but normally it's like 6 to 8 glasses or bottles of water. Okay. So you'd say about 2 a day. Mm-hmm. Okay, well, anything else? To get to sleep, food, water. How's your social life? That sometimes has to do with your health. Just don't worry about it. Okay, so I'm just gonna start the exam. Just give you a look over. The nurse did take your blood pressure though, right? You're right, this should be on the charts. It might be in the computer. Okay. Okay, I'm just gonna put this on your chest and listen to your heart really fast, okay? So just... Do you smoke? No. Okay. Yeah, just breathe normally for me. You are? Okay. Okay, now I'm going to listen to your lungs, alright? So I'm just going to go around you, put a couple different places on your back, and I'll just have you breathe in and out every time I move it, okay? So, here we go. Okay, breathe in, and out, in, and out. One more time, in, and out. Okay, I'm going to come around the other side now. Go ahead and breathe in and out. Okay, in and out. Okay, in and out. Okay. No congestion. Alright. A little odd. I'm just going to set this to the side here. I don't need that anymore. Though I probably... Have you been to a respiratory doctor at all in your life? Just at all? I'm not sure if it's on the charts, but do you have asthma? Okay. Odd. Truly, because I'm hearing some suspicious noises, but just give me a second to struggle with my gloves. Well, yeah, just for my safety and your own. Okay. So, you mentioned your eyes hurting and headaches, and you get nausea. Okay. Well, I'm going to shine this at your eyes. I'm just going to look at them really quick, okay? So I'm just going to do this and look at them one at a time and then together, alright? Okay. Just a little okay. Now together. Really? No, just hold still, please. Look straight at me. Okay, how about we try something else? Look at me still, and I want you to tell me when you see the pen light come into your view, okay? Yes, we're starting now. Okay. Alright. Very good. Mm-hmm. 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 Okay. Yep. Okay. So peripheral is fine. The dilation, though. Bit odd. Could be normal. But I'm not sure. Okay. So I'm just going to feel around your face, if that's okay. Alright. And see if there's anything odd going on around your eyes. When you experience headaches, where exactly are you getting them? Are they on your head, or do they travel to parts of your face? Okay. Mm-hmm. Ear pain, you said. Only with the headaches, though? And you didn't mention that to me. Okay. Well then, in that case, we are going to take a look. In your ear. Now this thing is busted, okay? It's like busted. So, I'm just going to use this to check in your ear, okay? With the help of this light, of course, because I can't see. So, yep, just tilt your head for me. Okay. Mm-hmm. Really? And only one ear or both? Okay. Well, I'd ask you if you clean your ears, but I mean, it's kind of obvious that you do. where you're just really digging around in there, because I can see pretty clearly into your ears. Have you had many ear infections in your life? Like 3. And how old are you again? 3 ear infections. Okay, okay. I nearly forgot to take your temperature, so let's do that while we're at it. Alright, I'm going to stick this in your mouth. The tip is clean. It's a new thermometer every time, okay? So just go ahead and open for me. Thank you. There we go. And now we just wait. Got any plans today? Yeah, no, you're not feeling great. But, yep. That was silly of me to ask. Okay. Okay, so no fever. Let me just write down some of my findings. Okay. You said you were experiencing a fever, so you come in here with no fever. Alright. Ears. And there was no pain on the face when I touched around. How about the nose? If I go down the bridge here. No. About here. Yeah, I can see you wincing. Let me just keep touching it then. Like, what kind of pain could you tell me? The start of a headache, okay. Headache, present. Okay. And eyes definitely dilate. Dilating. There we go. Okay. The eye pain. I'm going to feel your eyes now. Okay. So close them for me. The light didn't hurt them, correct? Oh. Okay. You didn't mention that. Yeah. I could have done something if you said, that it was bothering you at all, but you didn't. Are you experiencing eye pain when I do this? Okay, yep. Eye pain. And sensitivity to light. Now, is that all light or just my light? It is quite bright. Alright, so after my examinations and all of my findings, I'm going to say that you have a cold. Yes, you have some symptoms that align with a cold. You don't need a stuffy nose, or I mean, if you're saying you had nausea. Oh, I just wrote that down. Okay. Alright. I still think you have a cold. You want a second opinion? Fine. Let me get you into the next best doctor. Oh no, I'm not the first best. Oh no, I'm not the first best. Okay, so Dr. Alyssa. And her next appointment is literally right after this one, so you want it? Okay. Next available. I am Dr. Alyssa, yes. But that's also Dr. Alyssa. Do you not trust me? Obviously, you're asking for a second opinion. Okay. Well, I'll just give her my notes. Yes, so Dr. Alyssa will see you right now. Like, you need to go. You need to go now. Like, step back out in the office, say you're here, check in again, and then, yeah. So, if you want me to, I can prescribe you the medicines, the antibiotics that I would recommend. But I think we should wait. Yeah. I think we should wait because who knows, you know, since you don't trust me, I don't trust what you might do. Yeah. So, I guess it was a pleasure seeing you. And yeah, good luck with your second opinion. Hello, how are you doing today? Not too bad. Okay. Let me check you in, make sure we match the correct file. Basic things we go over almost every time you're in here. I need your name, please. Okay. And what's your date of birth? That's right. Okay, and so it looks like you came in because you're having some issues with your eyes. You think there's something in them? Okay. And have you tried, like, flushing them out at home? Have you done any sort of eye drops, just so I can, you know, be aware if you've used anything already? Okay. So, just your finger. Okay. All right. And doing that, like, was your hand clean when? Because that could. Okay, it was just kind of a natural reaction to just go. Okay. So attempt to remove discomfort. In eye with finger. Alright. Like I said, no eye drops or anything. Oh, you did use eye drops, so what did you use? Okay, so like allergy eye drops? Oh, you thought it had to do with your allergies. Okay. Alright. you've looked in your eye, did you see anything? No. Okay. Okay, that's okay. Do I have any other questions for you? Has this happened before? And before, have you, if so before, have you had a scratched, like, have you ever scratched your eye? You haven't? It doesn't feel like that? Okay. Yeah, let me take a look, okay? I'm just going to put that down. A new pair of gloves. Okay, and how long has this been going on for? I think it said in your notes when you scheduled the appointment, but I just didn't catch that. 2 days. Okay. Yeah, it was smart of you to come in. The longer you leave that, if there is anything in your eye, it can cause scratching and more discomfort and possibly infection, so we want to make sure we check that out right away. Is your vision blurred at all? Not that you can tell. Okay, so let me just hold up some pictures then. Can you tell me what you see in this picture? Okay. How about this one? And this one. Okay, I think you're all right there. So I'm going to shine this light in your eyes, okay? I'm going to cover the one first and see how your pupil reacts and everything. And it's this eye specifically, correct? Okay. Yeah, I'll still check both, but let me just see how it's working. Okay. Alright, let me do that again. Let's see this one now. Okay. Now, can I have you follow the light, please? Does the movement of your eyes hurt your eye at all? A little bit? Is it in a certain direction? Or, like, let's go up, down, and then side to side. More when, like, your eye moves in. Okay. I am going to get up close with the light, okay, so I can assess. So just make sure you're not looking directly at it, but I will have you look up first, okay? I'm just going to pull your lid down a little bit and check here. Okay. I think I'm seeing maybe a hair. Do you have pets? Okay, go ahead and look down for me, please. Just gonna lift your eyelid up. Okay, let's see on this side. Okay, and now look to your left, please. discomfort there. Turn, look to the right, please. Okay, just gonna lift your lids again a little bit so I can get a good look at. Okay. Okay. Alright, yeah. So, do you have any pets with like white hair? Yeah, I'm thinking that's what I'm seeing here. It could be easy to miss if you're just looking in a mirror, you know, depending on the lighting and stuff. It looks like it could be a pet hair. So, yeah, I'm going to just put some drops in your eye. It'll kind of numb the area, so that way you don't feel me really touching in there, because most people, you know, are sensitive when you go and put anything near their eye, so it's best if you just like can't feel it, because then you don't know. But I'm going to take some of these drops here. Okay. And I'm going to put them in your eye. So if you would look up, usually that makes it easier for us to put drops. Okay. No, I didn't see anything in your other eye. If I did, I'd be getting it, yeah. Okay. Let's do a couple more of the drops. Just to make sure. Okay, look up again. Okay, very good. Alright, and just like look up, then down, and left and right, please. And then we'll just kind of move that solution around. Got a little tray here that I'll place it in if I have to. Yep, I'll just get started here. Let me grab some new cotton buds. I know they're very long, they don't have to be that long, but yeah. So they don't have to be this long, but it just kind of helps me get good grip and maneuvering and everything. So yeah, I think I'm gonna have you like look off to the side like that, and I will try to maneuver it out with this first. I do have some tweezers. They do look intimidating, so you know, maybe don't look at them, but I've got some tweezers, and if I need to go in there and like yank it out, I will. But let me get the light back out. So yeah, just look off to the side there, since it's mainly in this corner, and I will work on maneuvering it out. Let's see, yeah, look, yeah, up and over would be better. Thank you. I'm just gonna move your eyelid just a little bit. Alright, and I'm gonna hold your eyelid down and work on scooping it out. Scoop, 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 scoop. Okay. Yeah, your eye looks a little inflamed from it being in there for a little while. Let's just it's moving a little bit. Are you feeling any discomfort as I'm doing this, or just a little bit of tugging? A little bit of tugging. Okay. That's good. That's good. That's what we want. Alright. I think I am going to have to bring in the tweezers just to stay calm for me. Stay calm for me, okay? I'm just gonna. Are you like snuggling up to your pet or so, or did it just randomly happen? Yeah, I've gotten a pet hair in my eye before. It was more of like a hair. You know, Australian Shepherds, they have more of the fluffy fur. Yeah, so it was uncomfortable, but it didn't hurt. Now, if you've got a pet with more wiry hair, then I can see how it would be uncomfortable. But okay, I think I have it. Oh, it's decently long there. It's a long-haired dog. Okay, yeah. Let me check the eye again. Make sure there's nothing else in there. I wouldn't want to send you home just to have you come back, you know. Have to come back right away. Okay. Oh yeah, I've gotten pet hairs in my mouth and throat. That sounds pretty common though. And then, I often, this is really weird, but with my shorter haired dogs, I get their hairs caught in my feet. They like to get caught in my socks and then jab me in the feet. So, it's like a splinter, really. I know, some interesting information, huh? But things happen, you know. I'm going to take this medicated ointment now, and so there's the other cotton swab. And just to prevent infections and whatnot in your eye, I will take a little bit of this. Okay. And just look up again. I'll pull your lid down and I'll just place it kind of on the whole bottom part of your eyelid. Go. And that should be quite soothing now that the hair's been removed and you know it's nice and cooling and all. It'll really help. So let's just sit for a minute. You can let me know how you're feeling. Close my box. Okay, yeah. Alright. Good. Now, just to make sure your vision is still not blurry, can you just read some of these letters off the chart for me? Get my pointer here. Okay. We'll just ignore the E chart. Okay. Alright, so stare right at the X for me. Check your peripheral vision and then I'll have you do some other things, okay? So, can you see what this letter is here? And how about this one down here? Good. And this one over here. And this one right here. Good. Now, you can go ahead and look at the letters. I won't make you stare at the X. Okay? Alright. So, can you see this letter here? Good. And this one here. That one. this one here? And how about this one? Good, okay. And nothing felt blurry. Alright. Great. Alright. Now with that in there, I'm just going to make sure you don't have any scratches on your eye, okay? Just confirming there are no scratches. We do not want any scratches on your cornea or whatever, you know. No scratches on your eye. Go ahead and look down. Just gonna check all around your eye. And left and right, please. Good. Okay. Yeah. Nothing shows up. Like there's a scratch. Sorry, my throat's a little dry actually. So yes, I'm going to say that you are good to go, okay? Move my gloves. Okay. And note that your eye has been taken care of, okay? And do you have any other questions for me or concerns maybe about care at home? Yeah, care at home is pretty easy with this. It's just that ointment in your eye. Just watch it for infection. Because I pretty much did everything that needs to be done. You know, when you usually take something out of your eye at home, if something gets caught in your eye, it's usually fine afterward. But if there are any scratches like really far under there that I can't see from maybe the, you know, the end of the hair or something, come back in, okay? But you should be good. It's really rare when anyone has to come back for something like that. All right, so. Yeah, like I said, if you do happen to see any other signs of infection in the next coming days, then give us a call. We could probably just get you antibiotics over the phone because I've seen you already. But if it's like where your eye is swelling up or anything like that, then I would of course want to see you again, okay? But that's the worst case. You should not have to come back. Okay. Good. Okay. So I hope you're feeling better now, and I hope you continue to feel better as the days go on. I have taken care of everything for you, okay? So, like I said, call back if you need us, and I hope you have a good rest of your day, okay? Alright. Well, hopefully I don't see you too soon, okay? Alright. Bye. Hello. How are you doing? Yeah, so I was looking over the notes from your primary doctor, and I can see why they sent you to me. So you're having some issues with some of the cranial nerves. Yeah, I can see the sensation. This was mentioned on here. Okay, so numbness. How about with hot or cold? Do you feel that? Okay. All right, and hearing as well? Does it feel like you have something over your ear that's muffling? Or, like popping in and out? Okay, well, we'll see about that. Nothing with the eyes was mentioned on here, so okay. And your okay, distance vision is pretty alright. I might check that. I do have some charts. We'll double check that. But yeah, I'm noticing some slowness in your blinking, in your mouth. Okay, so you're struggling to speak as well. Okay. Okay, your mouth moves a little bit more than that normally. Okay. So, yeah, we'll just test some sensations. I will probably do a lot of poking your face. Is that okay? It's just part of the assessments and tests here we have to run to figure out what's going on, okay? Perfect. So let's get started with that. I'm going to need to put on some gloves. My gloves are going to be kind of big and awkward, okay? We'll see if you can feel that, okay? You can never find the size I need. I'm just going to pull out some tools that I'll be poking you with. We'll start with the vision, get that out of the way, since you said it wasn't much of a concern. Let's get out these. Okay. Perfect. And I'm going to also be spritzing you with a little bit of this. It's perfume, so it's not like it's, you know, just straight water, but it'll help me. So let's start with the vision. And I'll shine a light in your eyes in a moment, okay? Alright, so I need you to stare at this X, and without moving your eyes to any of the other letters, and keep it right here for me, I need you to tell me what this letter is. This is a peripheral vision test, yes. What is this one? Okay, this one. This one. And this one. Okay. How about this one? Good, this one. This one. This one. What about a diagonal? Good, okay. And then, which way is the E facing? Okay, this is a normal E. Just tell me like where the center one is pointed, I guess. So we'll say this is right, down, up, left. Okay. I don't understand this chart either. It's very confusing. Okay. Mm-hmm. How about any of these? This one? Good try, good try. Okay. Yeah, that's about right. I expected. It's not easy to read that bottom line anyway. Stare straight at me, please. Your focus seems good. Can you follow the light now? Perfect. And cross. Back to the center. Good. Okay, tracking is good. Stare past me, please. Okay, I'm going to divide your eyes here. Check this. Okay, cover the one. Yep, keep staring past me. Thank you. Okay. Okay. Alright, that's good. Nothing out of the ordinary there, like we expected. So, sensation and hearing. Sensation is the most concerning thing we have here. So, I will start by just feeling your face, okay? And you tell me where you can and cannot feel, okay? Can you feel here? So you have some sensation on your forehead. Where exactly do you lose it? Tell me where you lose it. There? Okay. And across the nose as well? You can't feel that. Okay, how about if I go up the bridge? Just there. Okay. So the whole bottom half is pretty numb for you then? Do you feel me pressing on your face? Okay, you feel the pressure, but you don't feel like the gloves, really? You don't feel what that feels like the soft, feel it with your hands. That soft, rubbery latex material? No. Okay. Okay, let's proceed now. We'll start with the good old sharper dull test. Have you had that? I assume so, yeah, with the previous cranial nerve exam. So I will use this stick with the cotton bud side to be soft, and this one to be sharp, okay? Okay, so close your eyes for me, and what was that? Okay, so let me show you. This one is soft, and this one is sharp, okay? I do have to kind of drag them because of just being poked with them is kind of hard to tell, okay? So just gently little rubs with them, okay? Alright, so how about that? Soft. Okay, good. And that. Sharp. Okay, now I'm going to start moving down your face. But you can feel that across your forehead. Okay, what was that? Good. Okay, how about this? You can't tell. Okay, let's keep going. Alright, like I said, moving down your face. How about that? You could guess, but it would probably not be best to guess. Okay, you cannot tell at all there. How about this? Okay, yeah, that one was sharp. That. How about over here? Soft. Okay, maybe just a portion of this side. Let's try again. Sharp. Okay, but not on this side. Can't tell what that was. How about this? No. Okay. let's go back to the nose. How about this? Or this? Neither one of those. Okay. Okay. Do you feel this? Just pressure. Okay. And how about this? Again, just the pressure. Okay. All right. Well, we do have a predicament here, I'm not gonna lie. Let's try something else, okay? I'm going to take these feathers and just drag them over your face. And again, do you feel it up here? You do? Okay. When I drag down, do you still feel it? Try that again with this one. No. Okay, what about the sides? Do you have feeling like along the sides here, or is it just here where you can feel still? You feel that? Okay. Not that. Okay. What about under the jaw? Do you feel that? Okay, it tickles, right? Okay. Alright, so let's move up. Go up. Do you still have feeling when I do that? Or do we start to lose it? Okay, the chin though? No. Okay. Okay, what about your eyes? Okay, can you close your eyes for me? I'm just going to run them over. Do you feel that? And do you feel it how it's supposed to be felt? Or is it just, again, like you know it's there, but you can't tell the feeling? Okay, so you can feel that? Okay. Okay. Now, I'm going to take this stick and I'm going to roll it. Okay, you feel that? Okay, so we're going to do that over here. Pressure, right? Okay, pressure. Now I'm going to drag it. Pressure still, right? But you don't feel that it's a wood stick. Give me your hand again. That's what we're supposed to be feeling. Do you feel that? No, not on your face. Okay, how about this side? Just, okay, so there's a little bit of sensation there. Okay. I wonder what that could be. Just looking at this face mapping chart here, all of these are possible areas that could be affected, but just because you can't feel in those spots does not mean everything's shutting down, okay? So don't be concerned about that. I was just wanting to see the area that's not affected, possibly. Okay. Alright. So, it's mentioned a little bit in your chart, but what was the start of this? Was it random, or did you have an accident that had this, follow it, or... Okay. You hit your head pretty hard. Okay. And did you have a concussion? Was, like, anything concerning with your neck going on? Like, because we don't have the ER notes if you went to a, separate ER. Concussion and no signs of a stroke, perhaps, or okay, because I'm not seeing the obvious left side drooping, you know, so I'm going to again poke you. This will feel like this, okay? You just feel the pressure. Not like it's not a sharp poke, but it feels like it's pretty close to it. Don't feel that, just the pressure. Okay. Up here you do though. Okay. Let me check the response of like the blood flow to these areas as well. I'm just gonna press. The refills pretty normal. It's spots. Press on your nose a little bit. Okay. Okay, it looks like blood flow is fine. I'm wondering if something happened in the spine though with this injury, because that could damage the nerves, or at least the messages being received by them. Okay, so okay. Let's try the mist now, okay? And we're going to start with your forehead. You felt that hitting your skin, correct? Okay, close your eyes, please, because we're going to start going lower. Did you feel that around your nose or your cheeks? Just a little bit up there. Okay. Again, chin. Nothing. Cheek. You felt it a tiny bit there. Okay, that makes sense. Okay. Alright, so let me... I'm gonna try alcohol prep pads as like dampness directly touching your skin, okay? Close your eyes, please, so I can clean you off. There we go. There we go, perfect. Okay. Let's try that. And I don't currently have any way to test heat over here. I also don't want to damage your skin because that's a concern. So this will be cold and wet, alright? And you just tell me if you feel it in these spots that I touch it to, okay? Close your eyes for me again. You feel this? Okay. How about here? No. No cold? Okay. Not there either. How about in this spot where we... Only slightly. Okay. Let's try your nose. Okay. Your chin. Anything? Not like how you feel it up here. Is this spot specifically how you feel it at the forehead or no? No, it's lessened. Okay. Okay. Alright, this has provided me with more information. I am going to suggest that we may do some blood tests, some more neurological testing because this is not normal, but it's not unheard of either. It's just not common, okay? So let me take my notes here. I do think it's damage to the receiving end of your nerves for your face. So if that is the case, after we run some of these tests just to confirm things, there is medication we can place you on to help rebuild that, but you will also need to do some physical therapies, especially with your jaw and such. Can you show me again, open and close your mouth for me? Okay. Does it feel like when you go to the dentist and get Novocaine? Similar, but a little different. Okay. Is it difficult for you to open and close your jaw at all, or you just don't feel the pull, I guess? Okay. Alright. Do you have anything else you need to mention to me? I think I've already written down most of the notes I needed for this. Okay. Okay. So let's move on to the hearing portion. Okay. Close your eyes for me. Do you hear this? Okay. And this? Okay. And this whole time, was I muffled for you at all? No. Okay. I'm going to try a sticky noise, okay? Do you hear that? Okay. Does the hearing loss come at any particular time? Showers and things. Okay. Allergies at all? Do you have? Sometimes when everything gets backed up into the ears, that can create that sound effect where it's like covered your eardrums. Okay. Do you go swimming a lot? And that's part of your workout routine? Okay. So I think that may be where that's coming from then, okay? So I would suggest maybe you don't want to put Q-tips in your ears, okay, but you can clean the outside, remove any water that way, okay. Even possibly earplugs. I believe they have those for swimmers to keep the water out if you have sensitive ears. Otherwise, you know, just it's kind of a thing that's hard to avoid because lots of people get water in their ears, but if it's constant for you, I'm wondering if maybe you need some sort of ear cleaning or drainage done. Maybe there's too much in there, but we also don't want a bacteria forming or anything from the moisture sitting in your ear. But did you have this hearing in and out experience when you went to the primary doctor? Okay, did you go swimming that morning? Okay, so I think that's part of that. We'll keep an eye on that, okay? And if we need to, we'll get your ears cleaned, okay? Drained out, and figure out the best method to keep the water out of your ears, okay? Alright, so I've done everything I need to do. Like I said, we need those blood tests done, so I will order those for you. And further neurological testing, just to make sure everything else is fine, and it's possibly just the nerves in your face that are affected, nothing else. And yeah. No other questions? Okay. Okay, yeah. No, it's my job. My job to help people. If you do end up having any further questions, you can always call the office, okay? And I can answer them at the time. Alright? Okay, well, hopefully we get this figured out for you soon, okay? You don't have to come back here too many times. And, yeah, have a good night, okay? Okay, bye. Hello. You are asleep. I mean, I know I can take a while to get into the room, but, okay, well, you're here for some extractions and measurements today. Okay. As you can see, I have my assistant Josie in here. Okay. She's going to be taking notes for me, so I can just keep moving with what I have to do. So, I remember from last time that you took home a custom face mask. Have you been using it? Okay. Okay, it's gone. Mm-hmm. Okay, I'll have the front make you the same thing over again. That's if you want it. Do you want it? Okay, yeah. Because just visually looking at you, I can tell that it has made an improvement since I was looking at the pictures that were taken last time. I can see a difference. I seem to have forgotten my light, so we're going to have to use a little makeshift one here. I'm just going to start by assessing your face. Okay. Like usual. And it can pretty much be up to you when we do the measurements or the extractions. The extractions can be a little painful. So maybe if you want to start off easy, we should measure first. You're okay with that? Alright. Let me assess what we have going on here. I'm going to start by touching your face. Is that alright? Okay. Just going to feel around. Is there any pain as I do this? Okay. Any irritation? Your dryness cleared up from what I can see. No pain anywhere. Okay, I don't see any like visible acne left over, but I just wanted to make sure there was nothing under the skin because we don't want to aggravate it further. Okay. Okay. Okay, I think we can move forward with the measurements and poking at your face. So, you feel that everywhere, correct? This is the same as this and this. Okay. Close your eyes and tell me when you feel this, okay? Mm-hmm. 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 Yes, that was 2. Okay. Good. Sorry, Dr. Brown is having some issues today with their throat. It's a little dry. The air is kind of dry, so doing some excessive gulping and probably going to need sips of my drink, so excuse that. Okay. Like I said, we'll measure and then I will clean your face before we start opening the pores and everything. We don't want stuff seeping in. So I'm going to set this against your nose, okay? And I just need you to hold still, please. Okay, we've got 3 on the left eyebrow, the right eyebrow, sorry. We've got 3 on the right eyebrow. 3 1/4 on the left. Two and a half inch nose. You getting this, Josie? Okay, because you don't seem to be paying attention, so. Okay, the length of the face is 6 1/2. Okay. Now, top to bottom, 8. Okay. Two and a half for the right eye. 2 1/2 for the left eye. Okay. Mouth is 3. To the nose is 2 1/2. Okay, and I'm going to just get your ear over here. 2 1/2 for the left ear. Okay, 2 3/4 for the right. Nothing wrong with that. Your face, nobody's face is symmetrical. Okay, nobody's. Alright. Space between the eyebrows is 1 inch. Alright, Josie? Mm-hmm. Now I'm going to get your jaw, alright? We're just going to set this over here. From ear to jaw is 2 inches. Corner of the jaw to the chin is 4. same on this side. Maybe 4 1/16. Okay. Now, just measure just to confirm. Now, Josie, I'm going to go down the line the same way I read it to you the first time, okay? If I say that's the same, okay? It's the same. Mm-hmm. Mm-hmm. I expect it all to be the same, honestly. Add a 16th to the jaw on the right side. Just to be sure. Mm-hmm. Yeah. Yeah, we're good. The jaw was the only difference. So I have to double check. These rulers do not measure the same, even though they are made to measure the same. It's really confusing. Okay, I'm going to bring this light in now. I need you to just pick one of the decorations behind me. There's a ghost right there that you could look at. I'm just assessing the skin, if you would feel better, even closing your eyes. That would be good. Just gonna double check these pores here that we were the most concerned about. Yeah, the nose especially is. Let me see between the eyes too, because I thought I saw something. Yeah, along the cheeks. The top there. Okay. Have you noticed anywhere else on your face that like really breaks out or feels like it's holding a ton of gook? Okay. Pretty much just the nose is what's bothering you. That's a common problem area. Yeah, sometimes we see people with blackheads like right in their ears. You can't see that though. That would be something I would tell you about if there was a problem. But there's not. You're in luck. Okay, so this is just the simple cleanser we're going to use to remove any topical oils, any molecules of dirt, bacteria. Tuck your mouth in for me. I'm going to get under your jaw as well. Okay. I'm going to just let this soak a little bit more in your nose. Okay. Very good. I don't know what it is about this office. It is just so cold all of a sudden. Okay. Now, look at my extractions kit. pressing on your face with the tools I'm going to use. I'm not really going to use the tweezer ones. They can cause scarring. All of these can actually cause scarring if someone who doesn't know what they're doing is doing it. So, we're in good hands here. Now, if Josie were the one doing this, she still hasn't mastered how. So, let's see, I'm going to use this one and this one. I might even need the pokey one. This one just breaks the top layer of skin gook that's covering the blackhead from escaping. You don't have too many whiteheads, so you don't have to worry about that. I'm going to use this mister to open your pores first, okay? Don't want to leave it in one area for too long because we don't want it to burn your skin because it is quite warm to open the pores. Okay. So my area of concentration is the top of the nose and the sides. Even in the crevices, it can get pretty bad there. Okay. Good with that. So I'm going to go around first with the one in my hand. The one in my hand works. We're going to see what comes up when I gently but firmly drag this down your nose, okay? The pressure helps push everything out. And then I'm going to wipe it off, okay? So we're going to press, drag, press, drag. Now the superficial stuff is definitely coming out. But there are some that look quite big that are deep in there, so we'll get in there with that. Okay, I'm going to move your nostril over and just drag along there, okay? We're gonna get in the crevice. Like I said, we want to make sure we pull everything out. Same thing on this side now, okay? And if it's a little painful, you can hold your breath, okay? As I do it, and then slowly let it out. And just not right in my face, okay? Kind of like do it down or something. Alright. Okay. There we go. Okay. Let's try this more concentrated side. It's got more surface area, so it will push for a little bit longer. Go to the side. Okay. Bring the light back in real quick. Okay. Yeah, so I'm going to use the poker. You're okay. Just sit still. You've trusted me for this long. So, I'm just gonna open some of these bigger ones here. Do on the side. 1, 2, and then 2 over here. Okay. And then using this tool, I can press. So we're going to be pressing and not dragging with this one, just pressing to try to coax it out. Alright. Press. Release. Press. And release. Josie, are you watching this? Yeah, I didn't think so. I can hear TikTok over there. Press. Release. I can't sign off for you to get further education if you don't pay attention to what's actually going on in the office. Press. Release. Press. Release. Thank you. Press. Release. Make sure I picked up everything there. Okay. So we don't want to do too much today, but we did clear you out quite a bit. Okay. If we kept going, your nose would definitely become inflamed, and we do not want that because it will take longer to heal because we are aggravating it, so it will need time to heal. Do you have a cooling moisturizer or any sort of cooling face product? Okay, if you don't, that's fine. I would suggest icing every once in a while. Ice, not the frosting. Do not put frosting on your face. That would be bad for your skin and would do the opposite of what we want. So, just one last time here, I'm going to open your pores and then I'm going to take the cleanser and cleanse your face again because those are not all open wounds but open areas on your face, which again, bacteria and things can sneak into. We don't want that. Okay, we don't want that. So we've opened the pores. Now we're going to open them again to clean them out. And then we're going to let them close, which shouldn't take long because the office is freezing. Because everyone else thinks that this is an acceptable temperature. It's not. It's not. I'm also going to apply a serum after we dab your face dry, okay? Just wipe it down again. Especially the nose area. This is cold, yes, so that will help feel better as well as begin the process of closing the pores. Okay. There's that. To pat your face dry, okay? Just pat. You never want to drag. Don't drag anything on your face, okay? Pat dry. and then work products in upward or pat them in depending on the instructions, alright? Okay. Josie, did you hear about the face mask? We need another one of this patient's previous prescribed face mask. Okay, thank you. Josie will let them know at the front and they will do it. Okay, that's good. So we're going to use this Timeless Vitamin C Serum. It will help brighten the skin and supply it with vitamin E and ferulic acid, as well as hyaluronic acid. Yeah, like the ridiculous commercials. Yeah, so. It does have a bit of an orangey smell, okay? It is citrus. A little bit of my gloves here. It says to use 2 to 3 pumps. I don't even do full pumps when I was obviously just squeezing it out of there. Pretty much just the equivalent of 1, maybe 1.5. Because while it does dissolve into the skin fairly well, doesn't sit on the skin. We don't want to overdo, especially this is the first time we're putting it on you, so we don't want to chance anything. Just slowly introduce it. Okay. It recommends after we've applied it to pat it in. Okay. Remember upwards motions. There we go. Okay. So I believe we have done everything we said we would do today. Measured extractions. Did a little bit of a cleanse. The measurements, we'll just use those to monitor your face moving forward, and of course if anything should happen to your face that is critical where we'll need to reconstruct, we have the previous pictures, but we also have measurements now, so we hope nothing happens to your face, but in the off chance something does, we have everything ready to go. So it's just a precaution here at the office. Okay. Well, it was nice seeing you again, and I hope the extractions help. Like I said, ice or cooling moisturizer, they're probably going to be your best bets here. Do not add any new products right at the moment to your regimen, because we do not want anything aggravating your face. It'll just help narrow down if the extractions did not, if your face didn't like them, it'll help narrow down instead of adding products in them or wondering was it the extractions or the product. The serum we used is totally fine for this situation. If you are interested in it, you can get it up at the front, but I wouldn't apply it too soon, Yeah, just because we've already done it to your face and we want to slowly introduce. But other than that, you are good to go, okay? And if you need anything in the future, let me know and we'll schedule an appointment. Alright, well, I'll see you around then, okay? Alright, bye. Hello, welcome into the eye doctor's office. Optician. So, you are new here, correct? Yeah, I had a chance to look at your file earlier, and it looks like we've never seen you before. So, let's just open your file here. There we go. And can you tell me a little bit about your eyes? Have you had any surgeries, any concerning issues that run in the family, perhaps? Anything of the sort that may be important to know that you might not have noted before? Okay. Alright, so you wear glasses then? Okay. And how often is it? All the time, or only while you're reading or driving? Okay, only for those reasons? Okay. Okay, and have your eyes currently been bothering you? Or are you just here for the yearly, bi-yearly checkup? Okay. Things are a little bit fuzzier? Okay. Does that improve when you wear your glasses more often or not? Okay, so it's more a distance issue now. Okay. Okay, let's begin with the exam now. I can always take more notes if I need to. Do you have your reading glasses with you? Forgot them at home. That's okay. That's fine. We can go ahead and figure that information out as we go. But since you're saying you're having a distance issue now, we might just have to get you a whole new set of glasses anyway. So let's begin by first having me examine your structure around your eyes themselves. So I'm going to come up and touch your face if that's okay. Alright. And then we will work on some lights. Do you have issues with lights at all? Okay. Alright, that's good to know. Just want to be sure before I go waving one in your face. These gloves are very difficult to slide on my hands. There we go. That one was easier. Sorry about that. Okay, so now I'm going to just feel around your face. Just any issues with the bone structures around your eye or eyes? Around your eye area? No fractures ever, or maybe bony growths, anything like that? No, okay. Go ahead and close your eyes for me. I'm just going to feel over the lids. Gentle pressure here, nothing crazy. Okay, good. Feel the bottom lids now. Nothing there. I'm going to press gently on your eye ducts. Okay, that feels good. Alright, and go ahead and open your eyes for me. Alright, I don't see any discoloration or really obvious blood vessels. Obviously, you have some in your eyes, but they're not like bulging or anything concerning. So I'm going to bring the light in now, and just not really directly aim it at you just yet. I want to slowly work up to that. Okay. Now, please just stare, maybe pick a letter to stare at on the chart back there. I'm going to see how your eyes react. Okay. Gently cover this one. Same over here. That's perfect. Do this. And this just to make sure they work independently but also together. Okay. Very good. Alright, now can you please focus on the light here? Thank you. And now focus back on a letter. Focus back to the light. Back to a letter. Okay, very good. Now please follow the light around. It's not going to go anywhere crazy. Okay. Good. Let's do this. And now please just follow it in a circle. Now, again, I'm going to have the light back here. Keep your eyes on it. I'm going to bring it up closer, 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 closer. Sorry, my hand's a little shaky. Back. Good. Do it again, please. Alright. All looking good there. Now, let's see. Do you have any issues with color blindness that you're aware of? Okay, we'll just do a quick test here. It's just the bigger ones. It's your difficulty with reading. Okay, can you see the number there? Yep, that was a 7. Perfect. This one. So 13. Okay. Here. Yep, that's a 6. And how about this one? Can you see this one? Very good, that's a 16. That's good. That's good. That told me everything I needed to know. Okay. Another chart coming up here. We're going to use this one a little bit. Just move this one. Okay. This is a peripheral vision chart, okay? Oh, you're seeing a reflection from the window or so. Sorry about that. But I need you to keep your eyes on this X. Are you okay? Can you see that? Good. Okay. Keep them here. And I'm just going to point to a letter around. Do not move your eyes. I know it's very tempting, but please do not. And I just want you to tell me what you see in your peripheral vision, okay? So, keep your eyes right here on the X. And can you see what this letter is? How about this one? Good. This one? This one? Okay, this one. And how about the one right there? Okay, yeah. So that is the end of that one. I know it went really quick, but you did a fantastic job. So let's see. Losing my markers here. Alright, I'm going to hold up different colored markers, and I just need you to tell me what the color is of the cap, okay? Okay. This. Very good. Got this. Good. This one. And this one. Okay. Now I'm going to use one of these. I'm going to draw a shape, okay, and I want you to tell me what the shape is. And the color of that is? It's supposed to be orange, it's looking kind of brown. Alright. Let's pick a different color. Well, that was my fast attempt at it, but we're not going to look at that one. What is this shape right here? Very good. Okay, let's do two more. What shape do you see here? Okay, and what color is that? Good. Oh, purple doesn't work. Alright, try again. What shape is that? And what color is it? Very good. And out of the three colors here, we had to abandon purple. Which one can you see the best? Yeah, which one stands out to you first? Okay, alright. Now I'm going to bring this chart into play, and we are going to drop the lenses in front of your eyes. But first I want you to tell me which line you can read, to. It can be any of the lines, whatever you can see the best to. So go ahead and pick the line you'd like to read. Okay. Good. 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 Close. Alright. Alright. Only a mishap. So you're just above 2020 here, which is where we would like you to be at, but totally fine, because we can fix that. I'm just going to point around and ask you what some letters are, okay? Is this one? Good. And this one? Good. How about this one? That one again? Good. And this one, and this one. Perfect. Nothing from here? Nothing from here at all? Do you guess at that one? Okay, yeah. Let's bring in the lenses now. Okay, I'm just going to slide this machine over a little bit. I'm going to drop it down right in front of your face. Is that comfortable? It's a little off. There you go. Better. Okay. Same thing now. Are you able to read this line clearly? Go ahead. Very good. Yep. It was this one you messed up. I think you thought it was an F as well. Totally fine. But let's try 2020 now. It's a little fuzzy still. Okay, let me switch this real quick. How about that one? Still fuzzy. Alright, give me a second. How about that? Try it again. Good, good. Can you read from this line at all? Some guesses here and there. Okay, but you can see all of the rest of the letters clearly? All over the chart? Okay. Yeah, so I'm thinking you're just going to need a simple prescription at the moment, since this is a new issue. So, this. Can you see everything with that one? Okay. And I flip this. How does that look? I think the other one was better. Great. Here we go. Okay, I'm going to do one more thing. Okay. That. Let's compare it to this. This is still this one. Okay. Yep, I will write that down and we will get that prescription started for you. And you may even be able to replace your reading glasses completely with just wearing these constantly. Let me get my iPad out. Gloves off. Do you have any questions? No? Okay. Totally fine. Totally fine. Glad we could get this figured out for you. Alright, so we need just look at that. Okay, get your prescription in here. We will send that off, have lenses made, and you can go out to the front and pick your glasses, okay? Your frames, more specifically. Yes, one of our lovely assistants out there will help you with measuring and everything for the perfect frames. Oh, don't let me forget. I need to get your pupillary distance real quick. That is important. Okay, let's see what we have here. It's just gonna rest on your nose, okay? Stare straight ahead, okay? Okay, you're pretty even on both sides. That's good. That's good. That'll be important for your frames. Your lenses. Make sure we're carving them to the right places, you know? Okay. So that was... very good. Okay. Alright, now we are perfect. Do you have any questions about your visit? Anything else before I leave you? Alright, good. I'd just like to double check. The pleasure was all mine. Thanks for coming in. And I hope these glasses help you see a little bit better. Okay. See you next time. Bye. Hello, how are you doing today? Yeah, the nurse informed me that you were having some ear pain. Okay, yeah, just, can I have your name, please? Okay. And when did the ear pain start? So it's been about 3 days now. Does it feel like anything's in your ear? Water? Maybe sand? Have you been to the beach? Have you gone anywhere or had anything near your ears that shouldn't have been there? No? Okay. And how often do you get your infections, or did you when you were younger? Handful. Okay. I'm just gonna take a look. That'll help me determine what is going on. Get some gloves on. You haven't had this before? Nothing like this aside from ear infections. Okay. Are you having trouble hearing? Okay, so it's more on one side than the other. Alright, I got you. Alright, I'm gonna first start by looking at the outside of your ear. I might pull on your ears a little bit to maneuver them and just get a good look at the front and the back. And I will go in with the little speculum. Okay, put the otoscope in your ear. Alright, so I'm just going to come over here and look at your ear. On the outside. Okay, there's no pain on your ear, right? No pain. Okay, good. pull a little bit. Oh yeah, your ear canal is red. I can see that from the outside. Let's check this side. Okay, good. Palpate. Any pain with this here on the outside? No, okay. Let me just keep looking. I'm gonna move your ear. Okay. So you said you do have pain inside this ear as well, but it's just not as bad. Okay. The top on here, I'm going to go in your ear. So let me know if it's uncomfortable at all. Okay. Yeah, it looks like the side is quite impacted. I can barely see your eardrum with how much is going on in this side. Okay. Let's check the other side now. Okay, yeah. A little bit of the same deal, but I can visualize your eardrum, which is great. It doesn't look like it's got anything serious going on, aside from needing a small clean. Okay, yeah. So there is definitely quite a bit going on with this side. Do you tend to sleep on that side more often, or earbud favoring an ear? Okay. Okay, yeah. So, gonna grab some tools, alright? And I'll be right back. And we'll get started, okay? Okay. Okay, I've got some drops. I've got some applicators that we can use. My little ear cleaning toolkit. And alcohol pads. We're going to start with these. I'm not gonna do too much, like, excessive talking, because I understand you're uncomfortable and I don't want to, have you answering questions if you just don't feel good, Right. But I will tell you what I'm doing, okay? I'm going to use the alcohol pad and clean the outside of your ear. And then I have other cleaning methods for the inside. Just want to keep everything sterile. Open another one. Slide out bad. Same thing on this side. Yeah, it looks like the buildup is starting to work its way out of the ear as well. Like I said, I'm not going to ask too many questions, but have you ever had any damage to the side of your ear? Or this side of your head either? No. Okay, it's probably the earbuds. Probably the earbuds. Okay, I'm going to put some of this liquid into your ear. Okay, just going to put before I start digging in there, I am going to use Q-tips, especially on this side, because you do have the buildup coming out. So instead of like going in, because we don't want to push more in, I'm going to just kind of go on top of what I see already and take it out. We're just going to remove it. And that way there's less stuff that, you know, I'm going in with the tools and aggravating. I just want to make this as easy as possible, okay? Do you use Q-tips? I ask that quite often when I have patients coming in that need their ears looked at. Just be careful with those. I know I can't make people stop using them, but that side, again, doesn't have too much. It tends to push stuff in more than help bring it out, and that's what can cause the impactions as well. Okay. Go in with the scoop now. I'm going to use it to scrape the walls of your ear, remove all the excess stuff. The drops helped to soften it, so we should be able to get it all out that way. Otherwise I may have to go in with some a little bit more abrasive pick-like tools, but we'll see what this can do for us, okay? Okay. This bad one out of the way first, and then we'll go to the easier one. Check with the light as well, because I want to make sure that we're cleaning it good. Just a couple more passes with the tools here. I'm going to switch to this one. It's more of like a honeycomb shape. It's going to pick up anything that is loose that I, dislodged. So let's go like that. Alright. Just a couple more scoops in the ear. said, you don't have too much in the side anyway, so screw that easy build up. Get that out there. Perfect. Okay, perfect. So there is still the redness and irritation in there. Your ears may feel a little aggravated after this. I'm going to put in a different medicine now that'll help to get you home, but I would recommend you getting some ear drops. I can prescribe those for you, and it's just going to help keep the swollen, canal down, as well as discourage any overproduction of earwax for the next couple of days. I still, don't clean your ears out, make them squeaky clean. I've done that for you already. We do want a little bit of earwax in there just to protect everything, but we don't want it to overproduce. So let me apply some more of these drops in to soothe your ear for now. Okay. This side as well. Okay. Yeah, is your ear dripping a little bit? I noticed it was coming out. Let's see. Okay. Here we go. I know that can happen. It's alright though. It's okay. Okay, so I'll get those drops prescribed for you, and we'll get you on your way home so you can rest. I would say your ears will feel better within a week. Okay? But I want you to do the eardrops for the next week, whole week. Just so we can keep it from coming back. We don't want to, think it's healed and then it come back. So, yeah, 1 week of those, but you should feel better before then, okay? I would say just once a day. And which pharmacy do you prefer? Okay. Where? What street? Closest to here, or is there one closer to your home? Do one closer here. Okay, so that is on street. Alright, so we'll send that there, and you can pick those up. And I hope you feel better soon, alright? Do you have any other questions? No? Okay, good. Alright. So, I hope you feel better, and if you don't, of course, come back in, okay? Alright. Hello! Yes, I beat you into this room. I know, usually you have to wait. I finished up early with the previous patient, so thought I would come on in. The nurse took your vitals and everything right out in the hall. Your weight, everything like that. Okay, great. Yeah, sorry if you hear barking in the distance. We have a, I don't know if it's a vet's office or a pound that they've established next door, but hopefully the barking stops and it doesn't disrupt us a little bit too much, you know. Okay, so you're here for a cranial nerve exam, correct? Alright, good. We're in the right place. Let me just double check some things. You had a recent fall. Okay. And did you have any, like, symptoms after that? Okay. Okay, so your primary doctor said that they just wanted to get you checked over. Has anything like this happened before? Okay. And you don't feel concussed or anything, correct? Okay, yeah. Yeah, it's kind of silly how, like, some things can, I don't know if silly is the right word, but injure us more than other things. I've had somebody who has hit their head on a more high up counter, like, you know, just coming up, and really messed them up. And then we have people fall on the concrete and they're completely fine, you know. So, cranial nerve exams. I'm going to test your eyes, your ears, your nose, and your mouth, as well as just sensation of your face and a couple other nerves, but we'll go along with that, okay? Alright, so is it okay if I touch your face and just everything kind of going on with your head right now? Okay. Alright, I just like to check before I begin. I'm going to do some feeling of your face first. Where exactly did you hit your head when you fell? Look back. Okay. Alright, yeah, let me just see. Are there any lumps or bumps that you've noticed from a little bit of swelling? Yeah, okay. Oh, right there. Yeah, I feel it. Okay. Is that the only spot that really took? Okay, yeah. Okay, I'm just gonna check around your hairline. No scratches. I'm sure your doctor checked you for all of that, right? Okay, good. Okay. So I'm going to have you shut your eyes really tight. Alright. And I'm going to try to open them. Don't let me open them, okay? Good. Resistance there. Now open your eyes. And it's going to be kind of awkward. Don't let me close them, okay? I know. Eyelids are kind of fragile. They're not as strong as other areas. So you did your best. There you go. Okay, now I need to feel around your jaw. Okay, and bite down, clench your teeth. Okay, and open your mouth. Okay, I'm going to push on your jaw. Don't let me close it. Good. Okay. And can you smile real big for me? good. And frown. Okay, and scrunch your face up. Okay, good. Good, good, good. I'm going to feel your neck a little bit. Checking the lymph nodes, the collarbone. All seems good there. No injury to your neck, right? Your doctor checked for that. Just gonna feel your neck and a little bit of your spine. Nothing hurts when I'm pressing on it, right? Good. I think we're going to start with your mouth because I had already checked your jaw and everything. So I'm going to put this popsicle stick in the mouth and just observe. You didn't bite your cheek or anything, right? Open it. Thank you. No damage to your teeth that you've noticed. Good. Sometimes people's teeth take a beating when there's a fall or so. Okay, so yeah, go ahead and put your tongue to your cheek. Okay. And your left. And up. And down. Didn't bite your tongue either, I see. Okay, good. I'm going to test your taste, okay? So I have a common flavor here. And I just want you to try a drop of it and let me know if you can tell me what it is. Okay. Do you have any food sensitivities or allergies? Okay, good. Good, yep, peppermint. Very good. Checks out. Good to move on now. Alright, so back to your eyes. Can you stare straight at me, please? Good. Okay. Now, I don't want you to move your eyes right now. I'm going to bring the light in, and I'm just going to run them past. I want to see how they react. Okay, dilation seems pretty good. And this lighting, okay, that's normal. Okay, that's about normal as well. Good. I'm going to split you down the center here and check one at a time. Make sure the reactions are as they should be. Good. Now, please focus on the pen light here. Come out. And back in. Yep, you're gonna go cross-eyed. Very good. Out. And back in. And out. Okay. Now, follow the light around for me. Good. Sorry if I'm a little shaky. I probably didn't have enough for breakfast, so we're coming up on lunch though. Good. Down here. And over here. Good. Now I want you to tell me when you see my fingers come into your view. Again, stare straight at me. Testing your peripheral vision here. Okay. Good. 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 Okay. Good. Perfect. Good. 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 All right. Any trouble with your eyes that you've noticed? Blurry vision, irritation even? Look up, please. I'm just going to get a closer look here. Okay. Look down. I'm going to lift your lid. Good. And to your right. And your left. Perfect. Any sensitivity with me shining the light that close to your eyes? Yeah. Okay. Is that about normal for you though? Yeah, some people are more sensitive to the brighter lights anyway, so if it's not normal for you, please tell me. Alright, and I know my gloves are not the most satisfying to look at. Let me pull them down. We need to find me the right size. But I'm going to bring my fingers in and I want you to tell me how many I'm holding up, okay? Alright, good. Mm-hmm. 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 Good. Perfect. Good job, yeah. Tried to trick you. Okay. Okay, I'm going to hold up some colors. There are cute little decorative capsule buddies we have in the office. Just make people smile and whatnot. I'm going to pull out a color and I want you to tell me what color it is, okay? Alright, what is this little one? This little fella. Good. Oh yeah, no, this is not real medicine. They have little note papers in them. So you can leave little notes for your friends, but we just use them as decoration. See, this one's winking. Yeah. Okay, well, what color is this? Good. And what about this one? Mm-hmm. This one? Mm-hmm. And lastly, this one. Okay. Good. Let's move on to your ears. Alright, so I'm going to come over here and just take a look inside your ear. Looks good on that side. Let's try this one. Good. Okay. And no blood came out of the ears, nothing like that when you fell. Okay. Alright, so I do have to perform some tests. I'm going to tell you some words and I just want you to repeat them back to me, alright? So we're going to cover this side. Orange, apple, banana. Good. Good. Yeah, I was having a hard time thinking of fruits. That happens sometimes when you're on the spot like that, but let's try numbers now. Start on this side. 5, 3, 21. 5, 3, 21. Good. 7, 2, 32. Good. Okay, now I'm going to make this noise with my gloves. Can you hear that from over here? Okay. And I'm going to do it right next to your ears, and I want you to tell me when you hear it, okay? And then when it stops. All right, here we go. All right, now close your eyes and we'll try it again. Okay, and now keep your eyes closed. I'm going to make the same noise. I want you to tell me when you don't hear it anymore, okay? I'm going to be moving them away from your head, and we'll just kind of fade out, all right? And we'll just see how that goes. If you stop hearing it before I've stopped, then we have something to worry about, okay? All right. Good. Good. Perfect. All right, so everything seems good there. Let's move on to your nose now. Bringing the light back in, and I'm gonna get up close here. Yep, and we're just gonna check your nose. No pain or anything with your nose, correct? Good, okay. Alright, looks good. Nose is fairly simple with the test. I'm going to cover one of your nostrils and have you breathe in and out, and then I'm going to do the same thing with the other side, okay? Okay, go ahead and breathe in and out. Good. Breathe in and out. All right. And again, I'm going to need our sample here. Just some little scent pods in this container. I'm gonna wave it under your nose, and I just want you to tell me what you smell, okay? Here we go. Orange, good. Alright, that seems good as well. So far you're checking out just fine. I'm not concerned about anything really there. And lastly, we're going to do the sensation part of the test as well as reflexes. Okay, so let me get out some new cotton buds here. And we'll start with the reflexes because those aren't always the most fun. I need you to let your jaw kind of like hang, I guess. Yeah. Yep, there you go. I'm going to rest my fingers here. Just good. I'm going to put my fingers kind of along your collarbone here, just looking for different reflexes. Yeah, if I'm doing anything too hard or you're sensitive, let me know, because I do not want to be hurting you, of course, and that could give us a sign that something's off too. So now I need you to hang your elbow kind of like over my hand here. I'm just going to hit my thumb Same thing on this side. Good. Now go to your knees. Okay. All right. And your ankles, okay? So come down here. All right. That's looking good as well. And if you wouldn't mind, I need you to slide your shoe off because I need to run the end of this reflex hammer. I don't really remember what this side is called, but there's this little point here. It's not going to hurt you, but I just need to run it along your foot. Thank you. Okay. Yep, just trying to see if your toes curl up. And then I'm going to do the same thing with your hands, okay? Okay, good. Alright, I'm going to now test if you can feel the difference between soft and sharp. Have you done that before? Okay, yeah. So let's start with you closing your eyes, and I'm going to just touch your face in different spots with this tool. And I want you to let me know what part of your face I'm touching, okay? Alright, here we go. Yep. Good. 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 Perfect. Okay, so that was the soft. Okay, so that was the soft side. Now I'm going to use the more sharp side. Okay. Just the same thing. Tell me where you feel it. Good. 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 Okay. And could you tell the difference between the two of those? Alright, so let's begin then. I'm going to do both now, and you just tell me where I'm poking your face and if it was soft or sharp. Okay? Yep. Good. Good. Perfect. Yep. Yep. Good. 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 Great. Okay, so that seems perfectly fine there. I'm going to have you close your eyes again. And I'm just going to brush your face now. Give me your hand and I'll show you what this feels like. Alright, there you go. Yep, just a big fan brush. Same thing. We'll just do light touches. Do you feel that? Okay, and how about that? Good. And I'm going to do under here. Yep. Okay. Great. Now, I'm going to touch you with a new object, and I want you to describe to me what it feels like to you, okay? Yeah, scratchy. Yeah, it's not exactly steel wool. I wouldn't do that to anybody's face, but okay. So tell me where you feel this. Perfect. All right. And now I'm just going to do basically the same thing, but with temperature. Focusing more on temperature. Yeah, you can keep your eyes closed if you want. Okay, so I'm going to gently touch this to your face. What does that feel like? Cold, wet, yeah, okay. But I mainly want you to focus on the cold sensation, okay? Alright. And can you tell me what this feels like? Warm, good, okay. So we're going to go back and forth between those, and you just tell me which one's which. Okay. Good. 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 Perfect. Okay. Again, light touch. Just let me know if you feel it. Mm-hmm. Good. 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 Everything's good. Okay, so I have no concerns for you whatsoever when it comes to your cranial nerves, okay? Of course, you do have the bump there, so we want to watch that, but I'm going to send a note to your primary doctor and let them know that everything's perfectly fine and you don't need any further treatment regarding your cranial nerves. Just some ice on that bump and a little bit of relaxation as well. Yeah. Yes, and if you are experiencing headaches, of course, I would assume you probably do from time to time with how big that bump is. Any over-the-counter pain medicine, totally fine to take for that, okay? Okay, so everything's good then. Right. Is there anything else I can do for you today? Okay, perfect. So, yep, you are good to go home, and I would just recommend a couple days off work if you aren't feeling up to it. And just relaxing and some ice. And you should be back to normal soon, okay? Alright, thank you so much for coming in, and I will see you soon, okay? Alright, bye.